Hey y'all, it's Dina. I'm doing a fairly quick update. Today is July 2nd, and I went to see the plastic surgeon today for my pre-op appointment. So I thought I'd give you a little heads up and an update on what he said. My husband went with me, and we asked him all the questions that I just couldn't think to ask him when I had my original consult appointment on June 1st. And then I got approved for coverage by my insurance company for tummy tuck on June 21st, which was completely a shock, I think, to the plastic surgeon's office as much as it was to me. We didn't think that it would be that easy. I didn't. I went for the consult appointment just to see, let's get the ball rolling and see what all kind of hoops I need to jump through to get this approved. And to our surprise, I had enough documentation between my bariatric surgeon's office and my PCP's office for skin issues, things like rashes, medication that I've needed, and that kind of thing. And over the last 3 years that I've done that, that's what I needed to do, and that's what my bariatric surgeon told me to do in the beginning, and I listened, and I documented everything, and that was the ticket. And that's what the plastic surgeon said today. He said, you're one of the few that is able to get this covered, and I really believe it's because of all the good documentation that you had. So let that be a lesson to you. Make sure that you document everything from the very beginning, and that's what I've done. So what's he going to do? He's going to do a fleur-de-lis, which is a fancy way of saying a lot of people call it the anchor cut extended tummy tuck. And it means I'm going to have an incision going straight down from like my xiphoid process, which is kind of like the bottom of your rib cage, if you will, in the front, to the right above my pubic area. And then there will be one that goes this direction, like the bottom of an anchor, from one side to the other. He'll cut out around my belly button and then try to maintain that belly button, but he said sometimes the belly button gets lost in the process because with bariatric patients, the stalk that they create is kind of stretched out and too long, so he said we might have to do some creative stuff there. Anyway, long story short, that's what he's going to do, is that kind of incision. Healing at the point where I guess it's this way, where the T actually meets, he said, is that's the most prone area to break down in post-bariatric surgery patients, so we'll have to watch that. And with my job being as physical as it is in the operating room, that we don't really know how much time I'm going to have to be out of work, but anywhere minimum 2 weeks, maybe as long as 4 weeks. But he said, when you tell me you're ready to go back to work, then I'm going to believe you're ready to go back to work. But he works in the operating room with me, obviously, so he knows how much physical work there is involved, and that I may or may not be able to go back sooner or later. So anyway, there's that. Let's see, what else did we ask him today? I asked him about cost because I had no idea even what that was. He said, if you just walk into the plastic surgeon's office and you want a tummy tuck, and say that's what you're there for, anywhere between $8,000 and $10,000, but that the hospital will most likely bill the insurance company between $60,000 and $100,000. Oh my gosh. So glad I'm not paying that. And I asked him going forward to maybe next year I'd like to start saving up for mastopexy, which is like breast lift, and then I'll eventually need some implants too, but we won't do that at the same time. But ask him how much that cost, and I think he said between $5,000 and $6,000. I can't remember. That was a question my husband had. Can't imagine why. But anyway, asked him about pain control afterwards. He gave me prescriptions for Dilaudid, which is a narcotic, and Phenergan in case I get nauseated, and an antibiotic, and I'll take those. I'll start taking those post-op. And I'll also come home with the drains. There'll be 2 drains, like one on either side of my, I think the pelvic area. And then I'll also have something called an on-cue pump, which is a pain pump. So when I'm post-op, I'll show you guys pictures of that. But you get like this little fanny pack that goes along with it, and it's a ball. It's about this big to start, and it's full of medication. and they load that like in the operating room, and he puts this catheter in underneath your incision, and it's really for incisional pain, and it's really quite effective. It just kind of, the little catheter has holes all along the tubing, and the medicine just kind of leaks out. That ball is pressurized and it just presses it out. And it's very effective at helping control incisional pain. And then after 3 days, when the medication has run out of the ball, you can pull it out, or you can go to the office to have it pulled out. I'm a nurse, my sister's a nurse, and we've both pulled them out of other patients before. I am this time going to be a patient and not going to be able to pull my own out. So I'm going to call my sister and say, hey, help me out. So she'll pull that out for me. And then the drains I'll have in, he said it just depends on how much drainage is coming out, and but probably a couple weeks, maybe longer. So, and I won't pull those out of myself either. I'll definitely go in and have that done. I've pulled plenty of those out of other patients before, and I remember my JP drain I had with my Roux-en-Y, and that's not a pleasant process. It's a quick process, but and by the time you know it's going to happen, it's pretty much over, but it still kind of takes your breath away for a second. So not really looking forward to that. Let me see. Mainly I'm not looking forward to carrying around the 2 JP drains plus the pain pump, but I'm not looking forward to a lot of this journey. I'm not looking forward to, like, the pain. The anesthesia, very nervous about the anesthesia. I watch people go to sleep 40 hours a week in the operating room, but again, this time I'm not the nurse, I'm the patient, and it's a lot different. So, I'm already anxious. I told them they should start giving me the anxiety medicine now, and they're going to make me wait. Can't imagine why. I've picked out my surgery team. One of the advantages of working down there is I know everybody, and most everybody down there, I have to say. I would not mind being in my room, but I am female, and so I do really want the female staff working with me. So I've picked out a good crew and somebody who will keep my team happy at the head of the table for anesthesia. So that's all good, and so we're almost there. I am today, let's see, 10 days out from surgery. So I will be taking probably the end of the week or maybe next weekend. I'll take some pre-op skin shots. I did ask him if we can make sure to take pictures of the skin that's removed. I'm going to see if he'll lay it out, and so we can see exactly the shape of everything that he cut off. And his nurse that comes to the operating room with him will take pictures of that for me. And so I'll post that post-op, and they'll also weigh it. We have a scale, and they'll weigh, and so that way I'll know exactly how much skin was removed. I'll have to wear a binder for probably a month, and he said you just kind of gradually break that down as far as your wear time, and then you transition into Spanx. Swelling will last for a while, so that's pretty much, that's the main stuff that I wanted to know. I asked, and he explained a lot to my husband, who wasn't there on my consult visit with me. So that's that. If you guys have any questions, anything I didn't cover that seems like it would be an obvious thing and I've left it out, it's because I'm nervous. That's why I left it out. But just shoot me a message below, and I will be absolutely tickled and pleased as punch to share with you. This is big. It's been 3 years since my gastric bypass. I've maintained my weight. I've done great, and I absolutely could not be happier. Except if it was painless, then I'd be happier.